Hello, welcome to Excluded, COVID19 and C.F.S, Take 2. Apologies again to those that tuned in to watch this live on the 31st of May. Unfortunately, despite practicing for at least 3 days beforehand and ironing out as many IT glitches as we were able to, we had a nightmare, so the event had to be scrapped. So this is pre-recorded, but I am emailing everybody that put their name down to attend the event with various links. So when I ask questions, please look at those links and respond. To everybody else, just enjoy this talk. Okay, so here we go. Hello, I'm Sally Callow. I am an ME/C.F.S campaigner and social entrepreneur with ME Foggy Dog and Stripy Lightbulb CIC. I've been living with the disease myself since 2006. ME Foggy Dog started life as a quirky awareness and fundraiser back in 2014. But became a social enterprise in 2018. ME Foggy Dog aims to smash the stigma and create social change for people living with ME/C.F.S. Stripy Lightbulb CIC is an online training company launched in 2018 that educates healthcare and education professionals and also employers about ME/C.F.S, myalgic encephalomyelitis, also known as chronic fatigue syndrome, to improve the lives of people living with the disease. I will obviously be referring to it as ME/C.F.S because myalgic encephalomyelitis gets a little bit of a tongue twister to say regularly. Both social enterprises are award-winning and work for the benefit of the ME/C.F.S patient community in the UK and internationally. This talk will concentrate on the past 3 years. It will demonstrate how much ME/C.F.S has been excluded from both the COVID-19 and long COVID narratives. I'll show you this exclusion through the lens of my social entrepreneurship since 2020. As was said on the event invitation, this is a fundraiser. This is how I chose to raise funds during this year's ME Awareness Month. As such, I will be posting the Just Giving link alongside this video on all social media channels. It's also on ME Foggy Dog's website and Stripy Lightbulb's website. Research funding has always been woeful and would have to be increased 20 times over to be equitable with other comparable diseases such as multiple sclerosis. Please donate and help us to find a biomarker for this disease. Finding a biomarker would get rid of much of the undeserved stigma that surrounds this disease and makes having it much harder to bear. This event will be interactive as much as it can be. Now, this is a pre-recorded event. As I said earlier, if you signed up to attend the live event, I will have emailed you. Please click on the links and submit the answers to the questions that I'm asking. Everybody else, carry on. And there was also going to be a question and answer session at the end. Everything I say in this talk can be backed up with research evidence. But if anybody has a question, please email me at either mefoggydog@gmail.com or info@stripylightbulb.com and I will answer your questions. I'm always open to being asked questions because that will increase awareness of the issues that surround our disease. Okay, so let's get started. So this talk is concentrating on exclusion over the past 3 years rather than what ME/C.F.S is or is not. I would encourage you to sign up to Stripy Lightbulb CIC's online training courses for a comprehensive overview of the disease and the wider economic, political and social issues. But to understand the wider context of exclusion, there are a few basic things you need to know, and you can see those things on the screen. So what was known about ME/C.F.S before 2020? It can be triggered by viruses and in rare instances vaccines. 25% are physically able to be in employment. 25% are homebound. It's a multisystemic chronic disease. It's a spectrum disease, so it includes mild, moderate, severe and very severe cases. It's more prevalent in women on a ratio of 4:1. The defining characteristic is post-exertional malaise. Now, you cannot have ME without post-exertional malaise. The C.F.S part is an entirely separate issue, but you can't get a diagnosis of ME/C.F.S without post-exertional malaise. There are around 60 symptoms under the ME/C.F.S umbrella. The diagnostic criteria is a controversial issue. There are multiple, and there's also a massive debate about which one should be used and which one should be sent to the scrap heap. That's not what this talk is about. Research has shown that ME/CFS patients have a very poor quality of life if they are at the severe, very severe end of the spectrum. It has been equated to late stage renal failure, but with no end in sight. And there is no biomarker, treatment or cure. That's where we were at the very start of 2020. And that's why our community geared up to say, hang on, everyone's talking about deaths, but what about chronic illness? Because this is what we knew. So this is kind of the starting point for this talk. So on the screen, you can see the UK government research funding allocation for ME/CFS. There have been an estimated 250,000 cases of ME/CFS in the UK for at least the last 15 years. As I will go into in a little bit, this is a massively out-of-date estimate. So if you have a look at the 2017 and 18 stats, that was less than £1 per person per year. We cannot get better without research funding, which is why I work so hard to fund research with CureME, who are also known as the ME/CFS Biobank. They do ME/CFS research and also enable it worldwide. That's who I support with both of my social enterprises. As you can see, 2022 and 23, I spent hours researching how much research funding we were given in that tax year, and I was unable to find a figure. What I did find was the government are working really hard with the cross-party group and the ME/CFS task force to improve the lives of patients, but there was no figure publicly announced. Now, I don't know if I just could not find it, which in itself isn't good. Surely that should be transparent and open for anyone to find, or whether all this behind the scenes work means they haven't agreed that tax year's research funding. I've got no idea. I'm just hypothesizing. But anyway, so I haven't deliberately left it off. I did spend hours looking for that and I could not find it. I also asked people within our community if they knew, because I'm online friends with a lot of advocates and scientists and researchers, and no one else knew that figure either. Okay, so at the start of 2020, this was the UK prevalence. As you can see on the screen, 250,000 people living with ME/CFS. That estimate is used by national charities even today, and it is well over a decade old. In fact, while I was doing the research for this talk, I found a post that I wrote in 2014 that said that that statistic was at least 7 years old. So it's about 15 plus years out of date, because we gain around 9,000 new cases every year anyway, and that's outside of a pandemic. And I should say, over the weekend, since I did the live event that went wrong, Dr. Charles Shepherd from the ME Association has said that the national charities are very aware that this is a massively out-of-date statistic, and they're going to be working together to work out what they're going to say is the new estimate. Because as you can see further down, it says research estimates prevalence to be between 0.2 and 0.7% of the population. So the population of the UK in 2020 was 67.1%. So I've done if there are any mathematicians looking at this saying that's wrong, please do let me know, because I'm not the best on a calculator and I'm not the best at working out percentages either. So I worked out that 0.2% was 134,000 and 0.7% was 469,000. So what I think charities may have done is take the average, like the mid-range point. I think that's what they might have done. But my point that I'm making now is we didn't even know how many ME/CFS cases there were before COVID-19 started. And I should say, because this is an issue that crops up with my advocacy very frequently, when you're diagnosed with an illness by your GP, they have software and they put codes into that software so that your medical records are as accurate as they possibly can. That's one of their duty of care things they have to get right. They have to accurately diagnose you and make sure that your medical records are accurate. However, there are codes for post-viral fatigue syndrome and ME/CFS. However, quite often GPs either don't know what codes to use, or, as I'll go into a little bit later, put it down as anxiety, or if they don't believe in ME/CFS, which is common, put it down as something else. And I've now spoken to thousands of patients who were told by their GP, I think it's ME/CFS, but I'm not going to give you that as a diagnosis because there's a lot of stigma around that diagnosis. Now, I've got no way to prove that those conversations happened, but I know that I had those conversations with patients. So that's kind of where we are with the estimates. So I personally believe that with the COVID-19 cases now that are triggering ME/CFS, we could well be up to 1 million. But because GPs do not code ME/CFS accurately, you would think, I've got friends that work in the Department of Health and Social Care, and they said, in theory, they should be able to go to SNOMED, that's the name of the software, and type in how many people have been diagnosed with ME/CFS. Because that's what you've got coding for. It's for data. That's what they should be able to do. However, because coding is such a mess for various reasons, including some GPs not knowing what code to use or not believing that ME/CFS is a valid physical disease, coding is useless. You should be able to type in a search engine, how many people have this? Ta-da! That's how many people have been diagnosed. But we also have misdiagnosis and underdiagnosis because of the poor knowledge base on the disease. So it's all a big fat mess. So we have to go by research estimates, and the research estimate that said that, which I believe was nearly a decade ago, has to be updated, but that research hasn't been done yet, so we can't do that. So that's that slide. So it's all very back of an envelope maths, but that's all that is available to us, and I'm going to explain why. Okay, so now this relates to what's happened during the pandemic. So as you can see on the screen, this is the NICE guideline for ME/CFS. This is how NICE tells GPs to suspect somebody has ME/CFS. Now I'm going to call it a criteria. It's not a criteria, but it's what NICE has come up with by looking at the various criterias and speaking to scientists and researchers and things. So the NICE guideline was updated in 2021. However, it has always had guidance on how GPs should suspect ME/CFS. This is just the latest version. So ME/CFS does not show up on any medical test, and there is no biomarker available. And so a diagnostic criteria is the only way to diagnose ME/CFS. And although it shouldn't be a rubbish bin diagnosis, GPs do have to rule out other diseases and illnesses that have overlapping symptoms. For example, a relative of mine had about 6 months worth of tests, and the very last one she had, her consultant said to her, I'm going to do a test for blood cancer, and you'd better hope that it comes back positive because the alternative is ME/CFS and there is no treatment for that. But I do have treatments available for blood cancer. So this is why, although it shouldn't be a rule everything else out, you kind of have to do that in the real world to make sure that something that could kill you, such as blood cancer, gets ruled out. So this is the criteria. I'm going to read it from the screen. So all of these symptoms should be present. This is literally a screenshot from the NICE guideline that is available on the reference list that I'm going to attach to this post and in my email. So debilitating fatigue that is worsened by activity, is not caused by excessive cognitive, physical, emotional or social exertion, and is not significantly relieved by rest. Post-exertional malaise after activity, in which the worsening of symptoms is often delayed in onset by hours or days, is disproportionate to the activity, has a prolonged recovery time that may last hours, days, weeks or longer, unrefreshing sleep or sleep disturbance or both, which may include feeling exhausted, feeling flu-like and stiff on waking, broken or shallow sleep, altered sleep pattern or hypersomnia. And cognitive difficulty, sometimes described as brain fog, which may include problems finding words or numbers. So that's it. The bottom's slightly missing, but you're literally missing 3 words off the bottom. It's just these 4 things included on the NICE website. So in my view, the NICE criteria is all a bit vague, focused on fatigue, doesn't hint at the seriousness of the disease or that ME/CFS can kill in rare instances. Okay, this is the diagnostic criteria that I use in my social entrepreneurship, political campaigning and advocacy, and I prefer it as a patient. It's the Myalgic Encephalomyelitis International Consensus Criteria, also known as the MEICC. If you take a look, it goes into far more detail and you get a better idea of what the disease actually is. So it says a patient will meet the criteria for ME if they have A, post-exertional neuroimmune exhaustion, and that's compulsory, also known as post-exertional malaise and post-exertional symptom exacerbation. B, at least one neurological impairment symptom from 3 categories. Those categories are neurocognitive impairments, pain, sleep disturbance, neurosensory, perceptual and motor disturbances. C, at least one immune, gastrointestinal, genitourinary impairment from 3 categories. Those are flu-like symptoms, may be recurrent or chronic and typically activate or worsen with exertion, susceptibility to viral infections with prolonged recovery periods. That bit's key. Gastrointestinal tract, genitourinary, sensitivities to food, medications, odours or chemicals. And D, at least one energy metabolism ion transport impairment symptom. They are cardiovascular, respiratory, loss of thermostatic stability, intolerance of extremes of temperature. And for a diagnosis of ME, symptom severity must result in a significant reduction of a patient's pre-illness activity level. Mild cases equals 50% reduction in pre-illness activity level. Moderate equals mostly housebound, severe equals mostly bedridden, and very severe equals totally bedridden and need help with basic functions. The MEICC was the work of ME/CFS specialist scientists and researchers from around the world. Okay, so here's the breakout rooms that should have been. Anyone that I've emailed with this video that was going to attend the event, please do go to the Jamboard and discuss the differences between the NICE guideline and ME/CFS diagnostic criteria. When I say discuss, what I mean is, what differences do you recognise between the two? Which one, if you were the patient, would you prefer people to use? Which one do you believe NICE should be using? And I'm not gonna, you can have a completely different opinion to me. I want to know what your opinion is. Please do let me know your thoughts on the 2 different diagnostic criteria. Are you thinking, how can 2 different things be so different? Because they are very different. It says 3 minutes, but obviously this is a pre-recorded. So please do pause, answer the question and come back. Thank you. Okay, please watch this video. Myself and the wider ME/CFS community were shouting into the void at the very start of the pandemic. We could see what was coming because we knew the basics of ME/CFS, as I shared with you at the start of this talk. Morning everybody, it's Saturday and Maggie wants some cuddles, so she's joining me today. I wouldn't be a very good ME advocate if I didn't talk about coronavirus. In fact, viruses in general, from an ME perspective. As you can see, lifting Maggie up made me very breathless. Right, so ME can be triggered by viruses. There are numerous triggers of ME, but the majority of patients are triggered by a virus in one form or another. Now, without scaremongering, that includes coronavirus. When people say that they've recovered, that means they haven't died. ME affects 1 in 500 people. When you think of the amount of people that have got coronavirus around the world at the moment, how many of those people will go on to develop ME? There's no way of knowing, but it does affect 1 in 500 people. What I need people to realise is, if you have a flu-like illness, including coronavirus, and you're expecting to get better within, what, a week, a couple of weeks? If your symptoms continue for months, 6 months, a year, you need to start considering whether that could be ME. What I need to make clear is, your doctor will not be able to test you for ME. You've got an incredibly long diagnostic process because everything else has to be ruled out before a diagnosis of ME or C.F.S, depending on where you live in the world. So as you can see, I do informal advocacy with ME Foggy Dog. We were all writing blogs, writing to our MPs, posting stuff on social media, telling friends and family, please do be careful because everybody is at risk of becoming chronically sick. It's like Russian roulette. No one knows whether you're going to get it or your daughter, son, wife, mum. So we went from that, where we were braced for an epidemic of ME/CFS. And to be clear, before COVID hit, some scientists were saying actually what we're living in now is an epidemic of ME. And now it's tripled. And we were being ignored before COVID-19. Okay, so now this is the end of March. We were excluded from Group 6. ME/CFS was not included alongside other comparable at-risk groups. Now, we're not saying that we're at risk of dying, but we should have been in Group 6 as at-risk people. Because if you have a look at the MEICC, cardiovascular and respiratory are included in that diagnostic criteria, and also susceptibility to viral infections. So in 2020, ME/CFS was excluded from shielding advice. Severe ME/CFS patients lost access to carers and food, and financial support was withheld for people living with ME/CFS. Mildly affected people, who were also key workers, had to continue working because they were not exempt. I know many had to leave employment to reduce their own risk to COVID-19. 2021-22, we were not given vaccine priority. ME/CFS affected bodies respond negatively to many internal or external factors. These factors include viruses and vaccines. It's a rock and a hard place situation, but patients should be given a choice. Most had to wait for their age range to come around, myself included. A tiny minority were given priority access by ME/CFS aware GPs, and these are very rare. Now, my GP knows that I'm an ME/CFS advocate. We regularly talk about stuff that's cropped up in research, and she works with me when it comes to medications and stuff because she knows that I'm sensitive to medication. So she gets it. But when it came to COVID-19 vaccines, she was I am following the JCVI advice to the letter. So when JCVI say that GPs could use their discretion, how could they? Because it is well known, both before COVID-19 and now, that only around 10% have ever had any training on ME/CFS, and a majority believe that ME/CFS is psychosomatic. Now, during the live event, a GP said that he disagreed, that GPs don't think that ME/CFS is psychosomatic, and I will point you in the direction of Dr. Nina Muirhead's research study. She literally did a questionnaire of GPs in 2018, 2019. Admittedly, a lot of GPs didn't bother replying to that research study, but those that did, I think it says something like, I've got brain fog today, so it was something like 35% said that they were confident in managing someone with ME/CFS, and a massive chunk said that they thought it was psychosomatic. So that's a fact, that's according to that research. And I would also say that now the same people that don't believe that ME/CFS is real also don't believe that long COVID is real. And there is plenty of anecdotal evidence happening today, last week, 2 years ago, to show that people are being gaslit by their medical professionals, including GPs, that say this isn't a real disease. Or go to talking therapies, they can cure you. That's happening in real life. So saying to GPs you can use your discretion, how can they if they do not have the knowledge base on this disease? In 2023, we're still not in Group 6. We're not eligible for vaccines or antiviral treatments of COVID-19. Many, including myself, are still shielding without support. And this is something that I worked on with Stripy Lightbulb CIC about 18 months ago. We were literally asking the JCVI, Department of Health and Social Care, and everybody I could possibly think of to rethink not including MECFS in Group 6. But I was told that other MECFS organisations were doing the same thing and were on the verge of submitting a case study as evidence as to why we should be included. However, 18 months on and no progress has been made. So Stripey Lightbulb CIC is restarting this work, because if this is now we've got to live with COVID, but we're unable to live with COVID because we are susceptible to it, then we need to be included in Group 6, or at least be given the option to have the vaccine if we want it. Let me be clear, there are very few MECFS specialist scientists, and the question is, will any of them have been on the JCVI committee? That's my question. What criteria do you think the JCVI were more likely guided by? They are risking a lot of people deteriorating to a far more serious. They think that the economy's in trouble now. Wait until the millions that have got, in the UK, hundreds of thousands of people that got a mild MECFS get worse. And then they have to drop out of employment because they weren't given access to the vaccine. Crackers. Okay, I'm going to share some screenshots during this talk, and it was the easiest and most effective way I could think of to get you to see what's been happening. So Vicky Foxcroft, MP, has been helping me with my work, and she asked this question on my behalf as Stripey Lightbulb. So she asked the question, to ask the Secretary of State for Health and Social Care what assessment has been made of the long-term impact of COVID-19 on individuals with a diagnosis of A, myalgic encephalomyelitis, or B, chronic fatigue syndrome. Gillian Keegan responded, this was in March 2022, and said no specific assessment has been made. The National Institute of Health Research has funded studies to improve the understanding and address the longer-term effects of COVID-19, blah, blah, blah. Currently, there are no published findings on the long-term impact of COVID-19 in people with a diagnosis of ME or chronic fatigue syndrome. Well, yes, again, we're excluded. But surely, if you've got MECFS organisations, including mine, emailing the government and JCVI saying, please acknowledge that we are at risk from this virus, you would put that down as one of your priorities for this research, wouldn't you? So no specific assessment has been made. That to me means MECFS is excluded. Now, whether I'm taking that the wrong way, but why? My first question was why? Why have there not been any specific assessments? So after I and other organisations have been actively campaigning since 2020, we are being excluded from Group 6 by non-informed policy. Okay, another one from Vicky Foxcroft. She has been wonderfully supportive of my MECFS work, and she's regularly asked questions on my behalf in Parliament, and also sent emails to the Department of Health and Social Care on my behalf. Vicky knew, due to our conversations and emails, that many long COVID patients met the MECFS criteria, and that these diagnoses have been happening since July 2020. And I know this because I am an admin of now what did we call it? Post-COVID MECFS group. So anyone that's got MECFS but then also had long COVID, we opened up Jenny set up a Facebook group and I became an admin. And in July 2020, people were joining our group saying, I didn't have MECFS, but because of COVID, I now have MECFS. I've just got my diagnosis. So that's how I know it was happening in July 2020. Vicky Foxcroft also knows that MECFS has been classified by the World Health Organization as neurological since 1969. So why was it then not included in Group 6 alongside other neurological diseases? So the question that she asked in this instance was to ask the Secretary of State for Health and Social Care whether people who have received a diagnosis of ME or chronic fatigue syndrome will be included in future government COVID-19 guidance for people with neurological conditions. Again, March 2022, there are no current plans to do so. However, we will continue to keep all public health guidance under review. And then they post, these are the people that are included. Yeah, we know that. We want to know why we're not. So another question that I'd be grateful if you either emailed me with the answer or put it in the comment section under this social media post that you found this video. Why is ME/CFS excluded from group 6 when other neurological conditions are not? Okay, communication strategy. From the very start of the pandemic, I was asking for a communication strategy that concentrated on the chronic nature of COVID-19. So I was asking questions in the Ask Gov question and answer thing. Remember in the press conferences in the UK where members of the public were allowed to ask questions? So I was asking questions every day. Never got an answer. Local government were emailed, both of my local MPs, because one is my constituency MP, the other, Penny Mordaunt, helps me with some of my ME/CFS work, and my local councillors. But I did all of this mostly in March 2020 and April 2020 from my bed because I was dealing with my own bout of COVID-19 from the 23rd of March 2020. I knew that this communication strategy was essential to limit the amount of people that became chronically sick as a direct result of COVID-19. So I sent a variation of these questions to all of the people I've just mentioned, MPs, local councillors. But because I was asking these questions every day, I ended up saving them on my phone. But I was asking these questions from literally like the end of March 2020. So it was a Gov Ask question. So the questions were, it is highly likely that COVID-19 will trigger ME/CFS in some patients, whether they've had mild or severe symptoms. Will the government and Public Health England create guidelines recommending rest for recovery rather than activity? Resting is the advice given by ME/CFS charities and scientists. Ask Gov question 2. Given that thousands of post-COVID-19 patients in the UK are now joining online support groups due to a prolonged recovery period, often of 8 weeks or more, will the government and Public Health England, as was, be putting more emphasis on the prolonged recovery aspect of COVID-19? Okay, so this video is from the 18th of April 2020. Anyway, so I recorded this video from quarantine, and it should be said that none of this happened in real life. I 100% understand why preventing death from COVID-19 is the priority at the moment. But there is a very important issue that simply isn't being talked about apart from by one doctor, Dr. Sarah Jarvis, on Radio 2 and on her own Twitter account. COVID-19 is very highly likely to trigger ME or an ME-like illness in a percentage of people that have COVID-19. That means chronic illness for an awful lot of people. When we say chronic illness, there are people that have had ME for 30, 40, 50 years where they haven't been able to leave their houses. This is something that needs to be taken seriously, and we need the word to be spread as much as possible that the only way to prevent that is to rest. It seems counterintuitive. Your doctor may well have told you to do a little bit of light exercise to try and stop yourself from getting deconditioned. That light exercise will cause you to be more likely to get a chronic illness. That comes from something called graded exercise therapy, which comes from the PACE trial. If there are any journalists that can help us to get the word out, please get in touch because this is important. In 2015, the UK ME/CFS population were already a £3.3 billion economic burden. That will only go up the more people get it. There is limited help for patients. That will put an additional burden on the NHS. So you need to get the word out that the only way to prevent another crisis, but in the form of chronic illness, is to rest. That's the only way to prevent it. Unfortunately, even today, Boris Johnson is getting slated on Twitter for resting at home. That's the advice that I would give anybody, whether you've had mild COVID-19 or you've been in hospital but recovered. If you don't take it easy in those first weeks after, you do risk getting worse. You will get post-viral fatigue syndrome and then that may or may not lead on to another chronic illness. ME is a chronic, long-term, that's what chronic means, long-term disability, and I wouldn't wish it on anybody. And I'm frustrated that the media and the government and Public Health England aren't telling people about it. It's very highly likely. We could wait for the proof to show you, look at this research paper, this many people have gone on to get ME, but by then it will be too late. The only way to prevent it is to rest now. Like I said, anyone that can help us to get the word out, whether that's social media people, journalists, whatever, if you've got time on your hands and you can help me, because I am a one-woman machine with ME Poppy Dog, please do get in touch and help. Thank you very much. Okay, so I said we can wait until we get the research. Yeah, look how many people have got ME. Well, we now know. Research has shown, at least 5 studies as of last June have shown that around half of long COVID cases meet the diagnostic criteria for ME/C.F.S. We now know that. Those research studies estimate between 42% and 56%, so you kind of take mid-range, it's around half. But there are also scientists out there who are saying that it may be that those in the half that don't yet meet the criteria for ME/C.F.S develop it slowly, because you can get a much slower onset. So the research has to wait to see if more people, if the percentage of those with long COVID who actually have ME/C.F.S grows, because at the moment they might meet half the criteria but don't meet all of it. But, you know, if they haven't got post-exertional malaise, but maybe that kicks in slightly later. We won't know for another couple of years yet, because they are doing longitudinal studies. But I would say that central messaging RE rest never happened. And I know why. I know that it's, you know, economy first, people couldn't afford to take time off sick. But the counter argument to that is, if you don't rest, you'll become so sick you can't work, ever. This isn't a case of, oh, if I feel a bit fluey, I'll just force myself into work. Our bodies do not create or use energy effectively, so you can't push through without causing yourself to get significantly worse. And I've seriously seen thousands of people who said, I rushed back to work as soon as I got over the acute phase, but within a few weeks I was floored. I could not get out of bed. Those people now have an ME/C.F.S diagnosis. So although this is my own personal view, if I was a politician, I would have made sure that everybody got sick pay to allow for proper rest, to make sure that those people didn't drop out of employment, because that's exactly what's happening. People are dropping out of employment because they're now chronically sick with ME/C.F.S, despite all of our warnings. Locally, although a long COVID working group was set up at my request, that's local public health teams, NHS, council, local government, local council, everybody, politicians, and I worked with them for 18 months. A comms plan, which was the thing that I specifically asked for, never happened. My knowledge and expertise in this area was not listened to. Economy first, but it's now harming the economy. More on that later. They did do something about rest, but it was in 2022 at the end, like the second half of 2022. And it literally, maybe one sentence that just said, resting during the acute phase may help you to get over it quicker. It's like, no, what we're saying is you can't help but rest during the acute phase if you're that poorly. We're talking about in the weeks afterwards. If you don't convalesce properly, you put yourself at higher risk of chronic illness. So I've done an awful lot of work in the background, but none of it was successful in terms of people listening and taking it seriously. Okay, so hands up, who knows what long COVID is? Long COVID is an umbrella term. It is not a distinct disease in its own right. On the screen is the World Health Organization's definition. So it's defined as the continuation or development of new symptoms 3 months after the initial SARS-CoV-2 infection, with these symptoms lasting for at least 2 months with no other explanation. Under this umbrella term are a wide range of different diseases and illnesses, and I'm going to read a few of them out now. So post-ICU syndrome, organ damage. I personally have friends with liver and kidney failure as a result of COVID-19. Diabetes, myocarditis, GI issues, tinnitus, migraines, dysautonomia and Me/C.F.S. Unfortunately, there are thousands of people that say long COVID is a distinct disease in its own right, and they will swear blind that it's not Me/C.F.S. I wouldn't say that long COVID is Me/C.F.S. I would say that Me/C.F.S. is under the umbrella of long COVID, and we know that half meet our criteria, but I would never say that long COVID is Me/C.F.S. because that denies the experience of all the people with all the other illnesses that I've just read out. Over 5 international research studies now state that around half of long COVID cases meet Me/C.F.S. diagnostic criteria. These 5 studies are included in our reference resource list that will be shared with you in the post or the email that I've given this video to you in. That wasn't English, but you know what I mean. Yet this has yet to be acknowledged by the UK government, the UK Health Security Agency or UK media. The closest it has got is strikingly similar and many overlaps. Bar none, every long COVID TV special highlights those with symptoms that baffle doctors. But all of those people, when you listen to what they're saying, meet Me/C.F.S. diagnostic criteria. Journalists never seem to interview anyone with any of the other subsets or presentations of long COVID, thus proving that Stripy Lightbulb CIC has a long way to go in terms of educating medical professionals about our disease. They would not be baffled if they had not ignored and neglected Me/C.F.S. prior to the pandemic. Now, I'm not saying every single medic, but it's a tiny, tiny percentage that actually understand what Me/C.F.S. is. As I said earlier, only 10% have received any kind of education on the subject. It's been said to me many times that I must be happy that long COVID is helping to raise awareness of Me/C.F.S. What I would say about that is that if Me/C.F.S. is excluded from this narrative, how can it be raising awareness of Me/C.F.S? Exclusion equals no increase in Me/C.F.S. research funding. Exclusion equals research is being duplicated. Researchers that are new to post-viral illness are not building on existing Me/C.F.S. research and are starting over from scratch. Research funding is very limited given the scale of the issue, and I personally believe that some of that money has been wasted with the determination of saying that this is a completely new phenomenon. Exclusion equals risks harm from exercise-based therapies which are no longer recommended to Me/C.F.S. patients. Anyone that follows Stripy Lightbulb CIC on social media will recognise this image. So Chris Whitty, the Chief Medical Advisor, said, "There is no situation, there is no age and no condition where exercise is not a good thing." And then Stripy Lightbulb said, "This is untrue. Post-exertional malaise means exercise is contraindicated for Me/C.F.S. and many long COVID patients." The reason I'm including this in this video is because of this determination that none of long COVID is Me/C.F.S. and that's entirely new. The people that push exercise as a cure or a treatment for all known diseases have been applying for research funding successfully and are doing research studies on people that meet our criteria who are under the long COVID umbrella. Now, all you have to do is Google the PACE trial to see how controversial that is. And myself as a social entrepreneur and ME charities, researchers, physios for ME have all been emailing various research teams for the past 3 years asking, has this passed an ethics committee and are you screening for post-exertional malaise? At the beginning of the pandemic, no one had a blooming clue what post-exertional malaise was. You're risking harming an awful lot of people by running these exercise-based therapy research studies. We know that post-exertional malaise means that people react negatively to increased activity. That's either doing any form of exercise, walking, let alone going to a gym. And too many, like hundreds of thousands of people have been told to go to the gym because all they've got is deconditioning. If GPs or other healthcare professionals knew what post-exertional malaise was, they would not be telling people to increase their activity levels. I'm now going to show you how ME/C.F.S is excluded politically in the UK. This is an extension of the many political issues ME/C.F.S had prior to COVID-19. Politically induced stigma and neglect is not new. Apologies, it's going to be a series of screenshots, but I needed you to see this in black and white. This is how my advocacy and campaigning often works, as frustrating as it is. Okay, so again, all these screenshots. So Vicky Foxcroft asked on my behalf to ask the Secretary of State for Health and Social Care if her department will take steps to collect data on the number of cases of myalgic encephalomyelitis that have been triggered by a COVID-19 infection. Will Quince responded with, the department does not intend to collect this data. So obviously Vicky followed it up because my first reaction was, why not? So Vicky responded with, to ask the Secretary of State for Health and Social Care for what reason her department decided not to collect this information. And Neil O'Brien responded with, the long-term effects of COVID-19 and myalgic encephalomyelitis are separate conditions as defined by the National Institute for Health and Care Excellence. Data matters. You cannot acknowledge or manage that which you do not count. Remember that long COVID is an umbrella term that encompasses many different presentations of disease. I contacted NICE to see if what Neil O'Brien MP said was true. Okay, as you can see on the screen, NICE emailed me back and they've literally said, in case you can't read it because it's a bit small, I believe the department's response to Vicky Foxcroft MP's follow-up question refers to the fact that we have separate guidelines on the topics of managing the long-term effects of COVID-19 and ME, diagnosis and management. As background, when guideline NG188 was being developed, the panel discussed ME/C.F.S and decided that consideration of differential diagnoses was accounted for in recommendations in the sections on assessment and investigations and referral, and nothing specific about ME/C.F.S needed to be added to the guideline. The panel also agreed that no recommendation could be made about symptom overlap or likelihood of developing ME/C.F.S because not enough was known about the condition. The management of ME/C.F.S is therefore outside the scope of the long-term effects of COVID-19 guideline, and the panel were clear that conclusive parallels could not be drawn. We have not specifically advised Department of Health and Social Care on the collection of this data, as this is not NICE's role. So, as you can see there, sorry, I'll move myself. ME/C.F.S equals a differential diagnosis because, as I've already explained, long COVID is an overarching term that lots of different conditions are underneath. It just means COVID-19 triggered a biomedical or biological process in your body that caused another disease to start. And I do wonder if I asked the Department of Health and Social Care how many cases of diabetes were triggered by COVID-19 or how many strokes had happened as a direct result of COVID-19, whether they would come back and say, oh, we don't treat them as the same because there's two different guidelines. This answer in itself makes no sense. And NICE has literally said it's kind of included in the differential diagnoses. So no, they're not saying long COVID is ME/C.F.S, but they're saying it would be included as a differential diagnosis. Okay, another question. So Vicky Foxcroft asked to ask the Secretary of State for Health and Social Care if she will make an assessment of whether ME should be included in the list of potential long-term complications from COVID-19 on the NHS website. Will Quince answered with, there have been no specific discussions and we have no plans to make such an assessment. Again, the thing about they're two separate things, according to NICE. Despite many tens of thousands now having a confirmed diagnosis of ME/C.F.S as a direct result of COVID-19, the government is not planning to warn of ME/C.F.S being a potential outcome of even mild infections. Half of long COVID means that 10 to 15% of all COVID-19 infections go on to develop ME/C.F.S. So I'm going to ask another question that I would like an answer to. Would knowing that ME/CFS was a potential outcome of COVID-19 make you more COVID aware? Do you think the public knows enough about ME/CFS to understand what they are risking? Okay, another question. To ask the Secretary of State for Health and Social Care, how many people with long COVID have received a diagnosis of ME or chronic fatigue syndrome? And Maria Caulfield said the information is not available in the format requested. Why not? There's a couple of things here. The first thing is tests were not available, so no one can, well, a lot of people, myself included, cannot prove that they ever had COVID-19. So there is that. But we warned of that at the time. How can we prove that we've had COVID-19 if no tests are available? And now a lot of people are saying, oh, it's just a cold. They're not testing. They've not got proof that it came from a COVID-19 infection. Again, that's down to the government not providing and not ensuring that people can test to see if they've got see if they've got COVID-19. But also coding is an issue, as I've already said. If the coding's not happening and the tests aren't available, there's no way of putting the two together. However, surely there's a way to find out how many people, even if it's a qualitative research study, just speak to a lot of long COVID patients and ask them, have you now got an ME/CFS diagnosis? Do you meet the ME/CFS criteria? There are ways of doing it, even if the statistical data is not available. Another one, to ask the Secretary of State for Health and Social Care, with reference to the research by the ONS entitled Prevalence of Ongoing Symptoms Following Coronavirus Infection in the UK, whether her department has discussed with the Office of National Statistics on the reasons for which ME was not included as a potential long-term complication of COVID-19. Will Quince responded, there have been no specific discussions and we have no plans to make such an assessment. It looks like a copy and pasted response, doesn't it? Because we've seen this before. I worked briefly with the principal statistician of the ONS COVID questionnaire last year to try and get ME/CFS included in the form of post-exertional malaise being listed as an ongoing symptom of COVID-19. Because what they had was a list of things like fatigue, dizziness, earache, headache, mental health issues, anxiety, pain, lots of different things, visual disturbances, vertigo. But post-exertional malaise wasn't on there. And this principal statistician said that what they originally did was gather lots of data from long COVID patients, ask them what the most common symptoms were, and that's why what was included in the questionnaire was included in the questionnaire. And I said, but I was talking to people in July 2020 who said that they were finding that they were crashing after exertion. So surely post-exertional malaise should have been included at the very start of the questionnaire, because if half meet our criteria, then they would have been complaining about that symptom. To me, that makes no sense. But he said that was the data we were given in terms of what the most common symptoms or characteristics were in 2020. Unfortunately, as you probably know, the ONS COVID survey has been paused. And the addition of post-exertional malaise to the COVID questionnaire, I was warned, was entirely funding dependent. And he said, although I want to include this in the questionnaire, if we don't get funding, it's not happening. However, the funding issues from the government mean that this survey is paused, so ME/CFS is still excluded from official data. There is nothing in any government central official data that includes ME/CFS. Not even one of our symptoms, the key defining characteristic of ME/CFS. Okay, so remember the very start of this talk when I said that we knew prior to COVID-19 that only around 25% of people living with ME/CFS are physically able to be in employment. That's where this question ties in, because I asked Vicky Foxcroft to ask this question. To ask the Secretary of State for Health and Social Care how many people who have received a diagnosis of ME or chronic fatigue syndrome are currently in employment. And Gillian Keegan responded with, recent data from the UK Biobank suggests that there are over 250,000 people in England and Wales with ME/CFS. Information of the number of people in employment with a diagnosis of ME/CFS is not held centrally. You can see that's just a generic wishy-washy reply, because 250,000 is massively out of date. And it was known that 25% are unable to work. So even if they've just done an estimate, but they haven't done that because they've not collected any data. None whatsoever. Okay, so these headlines will look familiar to everybody watching this video. I've just picked a political magazine, a national and a local newspaper. So this is all about economically inactive people, people that are vanishing from the workforce. It's not an exodus. They were warned that this would happen. And the one on the right, Stoke-on-Trent Live, economically inactive DWP claimants likely to come under renewed pressure. The DWP has a history with trying to get very sick people back to work. Anyone that doesn't know what I'm talking about, again, please Google the PACE trial. In fact, I've put an article that I wrote on the PACE trial in our reference list. So if you want to read that, that'll give you an idea of what I'm talking about. So if 25% of ME/C.F.S patients are able to be in employment, that means 75% aren't able to work. So a massive chunk of the economically inactive stats will be ME/C.F.S. That's just common sense and maths working that out. So many will still be waiting to get a diagnosis and will still be pushing themselves into work every day. And I know that because that was me in 2006. I had to wait 2.5 years to get a diagnosis. And because I kept being fobbed off with talking therapies and, just go out, take your dog for more walks, you're just deconditioned. I didn't think if I continue pushing myself, I'm going to make myself worse. Pushing through will make them deteriorate over time, and they are basically living to work. While you're in that limbo period where you don't have a diagnosis, you do not think, I'm so sick I shouldn't be at work. You're just thinking, they keep telling me it's deconditioning. So there's a lot of people that are currently living to work. So what that means is you literally wake up in the morning, do the bare minimum in terms of having a shower, or you might get a bus now instead of walking to work. You do your work, but you're grabbing every single chance to rest that you possibly can. And then the second you get home, you're going to bed. That's not a life. And then you're sleeping the whole weekend, trying to make yourself as well as you possibly can, ready for Monday morning. If you work 9 to 5, Monday to Friday. So a large percentage, maybe 20%, are not currently included in the economically inactive statistics because without a diagnosis, they're pushing through and trying to stay in employment as much as they can. So I do not doubt that this problem of economically inactive people will continue to increase. I personally detest that term. Nobody is economically inactive unless you're homeless and don't have a bank account. Everybody is contributing to the economy in one way or another. The UK government has done nothing to prevent or acknowledge this. So it's not a mystery to the ME/C.F.S community. And the pressure, as I said a minute ago, DWP has history here. So please do read up on the PACE trial, because I'm pretty sure that they're going to be denying people benefits because they haven't yet got a diagnosis. Or they don't believe that long COVID is real, or that ME/C.F.S is a fluctuating disease. So I, for example, have been turned down for disability benefits because they said, because it's a fluctuating disease, how many good days did I have? And I said, well, I don't really have good days. They're all bad days, but some days are slightly better than others. And they said, oh, no, well, you've just admitted that you have good days. You're not sick enough to get disability benefit. That's going to be replicated in tens of thousands, if not hundreds of thousands of cases. So all of this come under renewed pressure, to get back to work. But who made them sick? Government policies increased the chances of getting COVID-19 and increased the chances of becoming chronically sick. So reap what you sow, unfortunately. So I accidentally caught this inquiry on Parliament TV in January 2022. I was literally just channel surfing. And I heard long COVID mentioned by advocates present in the room, but no mention of ME/C.F.S. So I wrote to the chair of the inquiry, which was the Plan for Jobs and Employment Support inquiry, and asked if I could supply written evidence. You can read our submission in the resources list or via the associated blog post on stripylightbulb.com. So I'm just going to give you two extracts. So the one on the right first. At least 5 international research studies have now stated that half of long COVID cases meet the diagnostic criteria for ME/CFS. This means that many of the current economically inactive people in the UK have ME/CFS. Please note, the UK government is not collecting data relating to the number of ME/CFS cases triggered by COVID-19, and so central government data on the prevalence of ME/CFS and the impact on the UK economy, jobs and employment is unavailable. But yeah, so I made sure that ME/CFS was included in this inquiry because no one else at that point had included ME/CFS at all. Okay, so purely to ensure that ME/CFS is included in this pandemic narrative, as it needs to be, because there are now far more ME/CFS triggered by COVID-19 cases than there were prior to the pandemic. So Stripey Lightbulb CIC contributed to the COVID-19 inquiry. I'm not sure if I'm allowed to publicly state what I wrote, so I'm not going to, but needless to say, all points mentioned in this talk were covered. Here is an extract from the submission. So I wrote, we repeatedly raised these points with both the UK government and or JCVI, but were dismissed without action. So it was a 3-page submission. Lots of stuff was included. So ME/CFS has been included in the COVID-19 inquiry. Quite simply, inclusion matters because exclusion increases stigma. I've said so many times over the last 3 years that a stigmatized community has now been further stigmatized by many, not all, in the long COVID community who are saying there is no way this is ME/CFS because this is really bad. ME/CFS people are just hanging on the shirt tails of long COVID because they're so desperate to be seen. We have faced... It's on both sides. I'm not saying that ME/CFS people are perfect little angels because we're not. However, our community has been around for decades. We're already heavily stigmatised and neglected, and we've faced a barrage of abuse for the past 3 years. And I'm not going to name names, but the determination to not see some of long COVID as ME/CFS has been blatant. Deliberately not allowing us in the room when actually this is our pandemic too. This is our epidemic of chronic illness too. We're not hanging on your shirt tails because we know that half of your cases are meet our criteria. I do get incredibly frustrated that our community were ramping up to look after all these hundreds of thousands of people, but we're being stopped from doing that because private conversations are happening about, oh no, this is a new disease, it's not that at all, and it can't be because this is really serious. That's not. To be clear, ME/CFS can kill people in rare instances. The stigma has to stop, and that can only stop with the inclusion of ME/CFS within the COVID-19 narrative. Anyway, yeah, so our community has grown exponentially. As I said earlier, I estimate there to be around 1 million cases now in the UK, but the charities are going to be working on a new, more up-to-date estimate in the coming weeks, months. So we'll now have a better idea of how many we have. Because all you've got to do is literally use the 250,000 figure, add 9,000 extra cases every year for 15 years, plus half of long COVID that's still sick at the 1 year point. You get to between 800,000 and 1 million. So our community has grown exponentially since 2020, but so has the associated and undeserved stigma, thanks to the spread of misinformation and stigmatising content in online groups and the media. My work continues. Thank you very much for listening. And I'd be grateful if you could head to the Jamboard again and leave feedback for this session. So those that were going to attend the live event, please go to the Jamboard on page 2 and 3. It's feedback. I would be really grateful to receive your feedback. Thank you very much. Good or bad, I need to know how to move on in future. So thank you very much for that. Hopefully now you'll see why we need research funding. Please do donate if you can. Every single penny counts. The Just Giving page will be closing at the start of June 2023. So if you watch this video after that, please either donate to whatever campaign ME Folklore is currently running or donate direct to the Cure ME website. Okay, thank you very much for listening, and happy Emmy Awareness Month. Sorry I had to do it in June.